Hi, good evening. Austin Mayor Steve Adler. Got a minute? All right, we're going to go through the numbers tonight. Talk a little bit about vaccines as well. Just to recap, yesterday was the highest number of new cases that we have ever reported during the pandemic. The number yesterday was 879 new cases. Yesterday was also the highest 7-day moving average of new cases, the highest 7-day average of moving average of hospital admissions, the highest number we've ever had of people currently in the intensive care units in our city, and the highest number of active cases we have ever held. We have uncontrolled virus surge in our city right now. And it's happening at a time when everybody is distracted by everything that's happening in the news. Everybody's coming off of Christmas holiday and New Year's Eve holiday. People are tired. It's happening while we're beginning to roll out the vaccine. And there's some people that wrongly believe that the vaccine is going to help us with this current surge that we're in. We're in a really rough place right now, and you don't have to take my word for it. It's the doctors and nurses that are in our ICUs that are reaching out and asking for help preserving space in our hospitals so that it is available for people that might have a heart attack or involved in a car accident, whatever. We're in a difficult time. Please remind your friends, extended family members of what we all need to be doing right now. But anyhow, let's go ahead and take a look at the numbers. We're going to take a look at, let's see here, the first dashboard. Let me see if I can do this. Here is the dashboard. You can see bottom or middle, left-hand side, new admissions today, 89. That's the same number that we had yesterday. But because the number's been going up, our 7-day moving average moved up from 87 to 89. Number of new cases today, 592. That's lower than our 7-day moving average. That would be a good thing if we are going to start sustaining that and seeing that happen. Maybe after New Year's Eve, people kind of redoubled their efforts. Maybe we're beginning to see something where the number of cases are coming down. But one data point isn't enough to draw a conclusion. Look at this chart that shows us in charting out the 7-day moving average. Look how high we're going up in that red zone. 17.8% is our positivity rate. I point that out again. Wasn't that long ago we were in the 3 to 5% range. All right, so let's take a look at the other dashboard that's on the City of Austin website. This is the one that tells us how many people are in our I think we clicked on the wrong one here. I apologize for that. Let's try this again. That was the dashboard we had just seen. Let's get to the new dashboard. Here it is. You can see that the number of people hospitalized, 575. That's only 2 more from yesterday, which means we had 2 greater admissions than we had discharges. Number of people in our ICUs went down. We were at 164 yesterday. Today, 157. Number of people on ventilators went up by 2 from 103 to 105. That fit 157 in our ICUs is pretty much on top of our 7-day moving average of 156. So the numbers are still real high. The number of hospitalizations we have tonight, 575, significantly above our 7-day moving average of 536. But if we're holding on ICUs now, if the number of cases are going down, Maybe we're beginning to see a change in behavior that happened after the first of the year. Again, way too early to know for sure. The number of people that have passed away, 568. That's 3 more than yesterday. I'm concerned with ICU numbers high, with ventilator numbers so high. We're going to see still a significant increase in that 568. We still have a lot of people in our hospitals. The positivity rate going up the way that it has gone up, and the number of people that are in our hospitals means that we've reached a threshold that the governor set. That by his order, if we sustain that here over the next couple of days, by his order, restaurant occupancy is going to have to go down from 75% to 50%. Bars, which were never allowed to open in Travis County, and by bars, I mean just bars. I don't mean the bars that are masquerading as restaurants under the governor's exception, but bars, had they been opened in Travis County, would have to close. But some of our surrounding counties did open bars. And if we sustain this number through the weekend, then those bars are going to have to close. Hospitals are not going to be able to take elective surgeries in order to be able to maintain a certain number of beds that would be available to us. Let's take a look at the University of Texas modeling dashboard, touch base with that so that you can see that. Let me share that. Here's University of Texas. The reproduction number is 1.27. Yesterday it was 1.36, I think, or 1.34. So that might be down a little bit. We really need people to maintain the discipline, avoid the big crowds, wear your masks, because at this 1.27, which is even if it were down a little bit from yesterday, is still a really high number. The virus is still growing at a really rapid rate. You can see what this line looks like with hospital admissions. The green dots are our actual history. The green line here is what's projected from the model. And you can see this number continues to go up to a number that is higher than where we were when we had the summer peak. What we focus on are that's hospitalizations. This is ICUs. Again, the dots are what our actual numbers are. These are the high CU patients. Remember, the hospitals told us that with the existing staffing, we could only plan on them having 200 beds that are available. We're at 157 tonight. But look at this chart. This is what's projected in the future. This is the 200 line, and you can see that we crossed that line on January 14th by the model, unless something changes. We're trying really hard to get additional staff from the state that might be able to extend us in the our number of ICU beds that we can staff. That would be good. We've taken the next step with the alternate care facility in the convention center, getting that closer to being something that can open. If our hospitals ask us to be able to move over their patients of lower acuities to free up beds in the hospital for the people that are looking at the more severe conditions. And remember, again, this is something that we do because the hospitals, looking at their numbers, believe it would be helpful for the community to be able to step in and do that. With the state, we've brought in a mobile infusion capability. Remember that therapeutic that the president got? It's not something that's available just to presidents. It's something that's available if you are the right kind of patient here in our city. The monoclonal therapy that's available have now moved a mobile facility over to the east side of town, so it's available for people to be able to use it and to access it. And then we have the vaccine, which is being rolled out. Now, you recall that the vaccine and how it gets rolled out is something that's set at the federal level and at the state level. So in our city here in Austin, Austin Public Health is one of 300 providers. I think that number is about right. The state makes an allocation to the different providers. We had been arguing that the allocation should be greater to Austin Public Health because if it came to Austin Public Health, they could make sure that it moved to the east side and to those people that were in greatest risk of dying, and that we could get it out a lot more quickly than the way that the state initially was distributing the vaccine, which was to distribute it and rely heavily on existing practices and clinics and drugstores and grocery stores. The problem with doing that in a city like ours, as we have talked about throughout this virus and throughout this pandemic, is we have the vestiges of what were pretty racist policies. So you see grocery stores and pharmacies and clinics predominantly on the west side of town. So if you have a distribution that is based on using those facilities, it's going to be weighted to the west side of town. But anyhow, that's how the state chose to distribute it, not from our point of view going to the right places and not getting out quickly enough. We have all been lobbying the state to give Austin Public Health a greater number of vaccines and let us demonstrate that we can get it out real quickly and we can get it out in those areas and communities that are the hardest hit, where the risk is the greatest. We had our House delegation, legislative delegation, join in, sent a letter to the governor making the same kind of appeal. And it's looking now like Austin Public Health will get a significant allocation next week. It's going to be setting up and announcing locations on the east side of town for the people that are in greatest risk. That would be the healthcare workers, people in nursing homes, people over 65, people that have medical conditions that make them most susceptible, but getting it to the people at the greatest risk where they live. No details yet on how to get to that. Probably Austin Public Health will deliver that through the health services that provide the care for people that don't have insurance. If you have insurance or access to a clinic that is otherwise getting doses, we recommend you use that and leave the Austin Public Health doses to those that don't have any other options. But next week, we'll get a significant amount, it looks like, and then we need to demonstrate to the state that we can get it out quickly. And hopefully that's something that will start with us on Monday. And we can demonstrate that we can get it out equitably, we can get it out quickly. And we really do appreciate the state trying something new and giving us a shot at trying to do this in a different way. So we'll get that larger allotment, get it to the people most at risk. We're appreciative that the state is going to give us that chance. I will emphasize, not everybody is going to be able to get the vaccine through this pilot program next week. There are so many people in those categories of highest need that I went over a second ago, over 65, folks with medical conditions that just dwarfs anything that we're going to be able to get supply next week. It's going to take us a little bit, even if we get increasing supplies from the state, in order to be able to get to everybody in that group. So we urge everybody to remain as patient as you can, and please keep exercising the preventative measures to protect themselves and other people. Know that we are working with the state and advocating for more allocations and larger allocations in the future. Our current situation is pretty dire. Hospitals and healthcare capacity We are really asking everybody to commit to stay home as much as they can to help control this surge. When you leave your house, wear your mask, stay 6 feet away from others, wash your hands frequently. Austin Public Health is strongly recommending that businesses allow their employees to work from home. For restaurants and retail businesses, the request is that you transition to takeaway, delivery, and drive-through services only. We're asking the public to really use our local restaurants and local retail. This is a tough time for them. Buy gift cards, buy things online, get curbside service. But please try to support our local businesses as much as you can. If there's an opportunity to tip, please over tip, because those folks need it the same. And then I'm going to close tonight, with all the kind of the bad news, maybe some hopeful news with respect to the vaccine trials that we're going to be a pilot. We're going to be able to try next week to get the vaccine out quickly and in the right areas. We got some good news today. The Housing Authority for the city of Austin received $1 million in mainstream vouchers. These are vouchers that are available to people making less than half of the mean income in our city to help offset the cost of housing. These folks still have to pay what they can. Usually it's about 30% of what the market value is of even the available housing. But this is a voucher that helps make up that difference. And HACA, having gotten these from the federal government, has decided to allocate them to folks that are living right now in our isolation facilities, our protective lodges, which is where we've moved a lot of people experiencing homelessness during this crisis, to keep them protected, to isolate them when they've had the virus, but to keep them safe so that we didn't see the same kind of surge and outbreak in the communities experiencing homelessness that many other cities have seen. It's a strategy that's worked really well, but now we have some of those people in those motels. We need to get them out and get them into really permanent supportive housing that will be long-term for them. That's about $1 million in value. We thank Michael Gerber and the staff and everybody at the Housing Authority for taking that resource and putting it toward communities that are experiencing homelessness. And then they got another 100 vouchers. These are project-based vouchers to create new housing opportunities. So these are vouchers that will be awarded competitively to folks that apply. They'll be just for people that are making available either new or refurbished permanent supportive housing. They'll be tied to the project itself to help these a new motel or a new building come online and be available. You just look around our city. We have too many of our neighbors that are unsheltered. We have too many people that are in tents and on our street corners, beginning to take the steps to get more and more people off the streets. This is a big part of it. Those 100 vouchers worth about $1 million a year. These are good for 20 years. So this is over time a $22 million grant from the Housing Authority in Austin, focused on what is our city's most significant challenge as we come out of COVID, and that's to end homelessness in our community. It's going to be my priority personally as we move out of this virus. But before we can talk about moving out of the virus, we've got to do something about the present surge. I won't go through it again. Please, mask, social distance. Tell your neighbors and your friends. We're going to enter the weekend now. You all be safe. Take care, and good night.